Good afternoon. So I am Dr. Robin Fenn. I am the chair of the Public Health Department at Bastyr University. I've got two incredible guests with me here today. So the first is Dr. Jonathan Kanter. He is the director of the Center for the Science of Social Connection. Did I say that right?
You did. Hi, Robin.
Hi, at the University of Washington. And then Dr. Dan Rosen, who is the chair of the Department of Counseling and Health Psychology, also at Bastyr University. So you might ask yourself, why am I sitting here with a bunch of psychologists kinds of folks if this is Public Health Week and we're talking about public health? One of the big things with the COVID-19 pandemic that we've seen, and we've heard this referred to in the media and other areas as the pandemic within the pandemic. It's the isolation, it's the loneliness, it's the depression, it's the anxiety, it's a lot of the mental health conditions that are starting to come out of dealing with a whole past year of uncertainty. And so Dr. Rosen and Dr. Kanter have both done some amazing work together. And so I want to spend some time talking to them, not just about how do public health and psychology work together to address the needs of our communities, but also how does Bastyr University and University of Washington work together? So I will turn the floor over to whichever one of you wants to start first. And if you could tell me a little bit about the amazing study that you guys wrapped up recently, taking a look at loneliness and social connection, and what can people do to get through that, especially in you know, this pandemic's not over yet. So gentlemen, the floor is yours.
Thanks, Robin. Jonathan, please go ahead.
Well, yeah, thanks, Robin. Dan and I have known each other for a while, working on a variety of projects together. And I think if you remember when the pandemic started over a year ago, here in Seattle, we were really the first city, the first region that was hit, the first epicenter. And so Dan and I were talking about what to do. My lab at the University of Washington had already started a survey study asking people here in Seattle how they were feeling. And Dan said to me, we need to do something bigger than that. We need to not just be surveying people, but we need to try to help people. We were predicting early on that this was going to be rough in a lot of ways. Mm-hmm. And so we hatched this study where we gave people tips every day over text message, solid psychological science tips for how to cope with the pandemic, with particular emphasis on how do we deal with the loneliness? How do we keep our relationships going? And how do we stave off depression? Anything you want to add there, Dan?
Well, I think at the time we were imagining like, oh my goodness, how are we going to get through a month of complete isolation? And we better move quick because the impact could be devastating. And of course, that feels naive a year and a couple months later, right? That we've all been doing this for a while. But I think it also speaks to how significant of a change it has been, and maybe felt more significant a year ago, year plus ago, when we were probably in these same spots generating these ideas and in this study. But yeah, exactly like Jonathan said, trying to figure out in a moment where we were feeling uncertain and I was feeling, I think, helpless to figure out what can we do to actually support our community, and came up with this idea.
So before you launch these interventions, and I really want to spend some time talking about, you know, these text messages and the things you sent and how you engage folks in this kind of way, but you said you were doing a survey of trying to assess, it sounds like, you know, how isolated people were feeling, or lonely or depressed. Were there any surprises in that survey? Were people more isolated, lonely, depressed, anxious than you anticipated? Or tell me about what your survey showed up a little bit.
Yeah, sure. Well, first, to give credit, the survey was really the brainchild of my graduate student, Adam Kuczynski, who put in the lion's share of the work on the survey. So he needs to get credit for getting the survey started pretty much very quickly after we all went, after our governor closed the schools for the first time. We started this survey here in King County. And to make a long story short, what we found was that here in King County, sort of two narratives. Number one, on average, most people were coping relatively well, better than we predicted. We did not see a wave of loneliness and depression wash over society. We didn't see that.
Mhm.
But the second narrative is that different people are doing very differently. We have multiple worlds within Seattle. Some people doing very well, coping very well, lots of resources, lots of support, and other people really struggling, as you all know. So those were sort of the two narratives that surfaced, I would say.
And this survey was done, it sounded like shortly after our governor, closed the schools and kind of put us all on lockdown. Did you continue surveying throughout the course of the pandemic?
Yeah, actually, Adam's survey, I believe, is still going on.
Okay.
I think that's another story, but we started surveying people every evening for 90 days, I believe. And then we got a lot of people to continue giving us responses once a week, which is ongoing, because we never, as Dan said, we never expected things to go as long as they have been. And the people providing responses to our surveys have just been so generous with their time, giving us this data that we can help understand how things are going for people.
And I took a look at your study, and when you say, people were generous with their time, we're not talking 5, 10, 20 people. We're talking, just shy of 2,000, if I recall correctly, about 1,600 folks. So it was a pretty decent number of people who said, yes, I'm going to continue to give you information and tell you how I'm doing.
Yeah, the original Seattle study had around 500 people in it at first. And then when we moved to the national study, where we weren't just asking people how they were doing, but we were also giving them these tips to try to help them do better, that's when we ended up with, about 1,500 people across the country.
So I'm curious about these tips. So we've got a little bit of a backdrop here, these 1,500 folks who are giving you information, who are telling you how they're doing. And you both said, okay, so what do we do about this? And how did you decide to send stuff out via text message?
Yeah, well, go ahead, Jonathan.
Well, I would say we chose text message because, well, we were rushing. We wanted to do something quick, and we wanted to get it to as many people as possible. And text was a really easy mechanism to do that. The other thing that happened really quickly is there's a lot that we know from psychological science on how to cope, on how to improve relationships. And it was Dan's idea to say, let's get some of this knowledge out there quickly to people. Bite-sized little chunks, just something people can use every morning. Do this today, and you may feel better by the end of today. And so we quickly came up with about 2 weeks worth of tips, a different tip every morning, based on solid psychological science, and deliver them via text message to people as quickly as we could. So that was the big idea.
Yeah, we were, I think, trying to pay a good amount of attention specifically to what gets in our way that has us not reach out, because it seems to be true for many people that it's exactly when we need to be reaching out for support and help that we feel least like reaching out. There's a narrative for a lot of people that I'll be back in touch when I feel better, when in fact it's getting in touch that has us, many of us, start feeling better. So, some of these tips were really about trying to understand what we named as internal obstacles that get in our way to reach out to our different networks, whether that's a loved one or an acquaintance, or even potentially, building a relationship. So trying to really focus in on the particular thoughts or the feelings that are most likely to stand as obstacles in our way to doing what we might actually want to do, or at least a part of us might want to do in terms of that social support. And then, just like Jonathan said, whether it's dealing with those obstacles as a a known entity within psychological science, or the types of interactions that when we move through those obstacles and actually establish contact or relationship with someone, that are most likely to produce positive connection and effects. We thought, are there ways that we could take what we began to talk about as these micro interventions, these sort of short exercises that ultimately we refer to as tips or suggestions. If we can get these in people's hands, might even a 5-minute or 10-minute allocation of time during this challenging period be enough to move the needle on psychological health for the people who participated.
So I am so curious, you guys keep talking about these tips, and I want to know, what are some of the tips, and can you share some of those? Are they big, huge academic kinds of things? Here's a huge article to read, or are they more real life, real folks kind of stuff that any of us can do, that my grandma can do?
Well, we hope we presented them in a way that your grandmother could do without knowing who she is. Yeah, we wanted it to be really simple and really practical, things that people could digest and implement on a daily basis. We had sort of 3 categories of tips. The first category was just about raising awareness of what we're feeling, raising awareness of what others in interactions we're having are feeling. Without awareness of how we're feeling and others are feeling, then the kind of the basic dance steps of relationships can't really happen. And so the first thing was about raising awareness of what we're feeling and doing so in an accepting and gentle way. Second set of tips was about, well, I know this is cliched for a psychologist to say, but it's still important, talking about how you feel. We want people talking about how they really feel. That's actually really important, even though it's cliched. And then the third set of tips was, when somebody else is talking about how they feel, how are we responding to that? How are we listening and supporting others in what they're going through? So those were the 3 categories of tips. I don't know, Dan, you want to give an example of 1 or 2 of them from your perspective?
Sure, I can share one of them. A lot of what we were attempting to do is take big ideas from psychological science and even psychotherapy and try to distill them in these bite-sized pieces that really needed no significant explanation, because we were imagining this as more of a public health intervention where people were really just receiving these text messages that maybe they would click on a link and get additional supplemental information, an audio clip, or some more content on a website. But we certainly weren't available to answer questions or be on the phone with anyone. So one of the ideas that we were exploring, consistent with both, an awareness perspective and some also sharing of ourselves and what we're feeling, is a metaphor that comes from the world of acceptance and commitment therapy that talks about how do we deal with some of these troublesome thoughts and feelings, what I referred to earlier as internal obstacles that might move us away from reaching out to someone, even though we might really like to say hello. So this metaphor has been termed the monsters on the bus. And the big idea is that we ask people to imagine someone that they would really like to be in touch with, someone that they'd really love to reach out to, but that they have some thoughts or feelings that get into the way when they imagine actually picking up the phone and initiating that communication. So, having doubts like, maybe they don't want to hear from me, maybe it's been too long. Maybe
they're probably busy. They've got a lot going on. I know they've got their kids at home now. Any of those kinds of things.
Any of those sorts of things, in addition to all the feelings of maybe nervousness or butterflies in our stomach. And so we ask people, consistent with this metaphor, to imagine that all of those internal thoughts and feelings and sensations were passengers on a bus that you are driving. So imagining that there you are at the wheel, looking to head toward this destination of, let's say, sending a text message or giving someone a call. And then as you do, all of these unwanted passengers are getting on the bus, right? So there's that thought of they don't want to hear from you, or there's that concern of maybe they're busy and are attending to their kid, or maybe there's that feeling of a tightness in my chest when I imagine, actually making this call. And would it be possible to imagine that all of those passengers can actually be on that bus and you're still driving and you're still going in the direction that you want to head, which is making the call, and that no one actually has to get off of the bus before you go ahead and hit send on that text or dial on that call. And that it's often when we kid ourselves that I'll wait till this perfect moment when the sun is shining, and I feel completely resourced and I have all the confidence. Maybe if we're lucky, we get one of those moments a day or a month. But most of us don't get many of them, or certainly weren't getting many of them, especially when you think back to a year ago, in the winter. And so how do we actually make room for all of that? So, what we did in the intervention is in slightly more slowed down way, we created an exercise where we were delivering the metaphor as an audio content that someone could listen to as many times as they needed. And then with the clinical team that Jonathan and I assembled to help generate all of these ideas, it wasn't just the two of us. We had a few other colleagues that joined us for several Zoom calls to build up, this set of interventions. We actually were going through each of the interventions ourselves. So Jonathan and I would interview one another and others on the team who are actually doing these exercises and taking these tips. So we were going through all of the study along with all the participants. It wasn't something we were doing to people. We were actually encouraging folks to imagine that they were part of a larger community, all of us going through these exercises. So that was one example. I wonder, go ahead, Robin.
I was just going to say, Dan, hearing you talk, this is amazing because when we're in that space where we feel isolated and depressed and lonely, and I'm not going to reach out, I'm waiting for that perfect sunshine moment, and here you guys are, these doctor psychologists, and telling me, maybe this, but to hear that you guys have your own monsters on the bus, and just kind of bringing it down to the real world and saying, yeah, this isn't something we're doing. I liked how you said that, Dan, to people, but doing it with people.
Yeah, I think with the passengers or monsters on the bus, if I remember, Dan and I did do that one together and recorded it. And I ended up calling a cousin of mine in New York City who I hadn't spoken to in a while, bringing all of my thoughts about why that was a bad idea to call him along with me. And it ended up being really nice. I'm now in better contact with my cousin. It's maintained to this day. And it really was helpful in that case for me personally. Yeah. And that's really important to how we approach the work in general. We believe in science. We are scientists, mm-hmm. and we wouldn't want to give people suggestions that we don't also personally believe in.
Right.
It's a human science. And, as I said before, I think one of the things we resorted to in this work was going back to what I like to call the basic dance steps of relationships, the things that are really important for all of us to do. It looks different for your grandmother because of her context and her culture than it might for me or Dan or for my daughter. It may look different for somebody with a different ethnicity or different racial identity. But with those differences in mind, the basic dance steps actually do play out pretty similarly across people, across cultures. What tends to be important in relationships, this basic idea that we're going to share something intimate about ourselves, how we really feel, and we want that other person to receive that gracefully, respectfully, lovingly. That basic dance step shows up in different ways in different contexts, but it's pretty much the same. And that's what we're really trying to get at with this study.
So listening to you both talk, and I just want the whole list of tips. Hearing the monsters on the bus and some of these cool things, and watching you guys talk about them and your faces light up, and Give me a couple more, because I know I'm not the only one I'm part of this interview, but other folks are watching it and they're going to want to know, hey, what other tips do Jonathan and Dan have for me?
Well, I think as I said before, the cliche from psychological science is we have to get people talking about how they feel. So there's sort of lots of tips around there, how to encourage people to reach out and connect with others. But what we hear less about, which actually the research suggests is even more important, is how you receive that from others. And so there was one of my favorite tips we called being a vulnerability hawk.
Okay.
And so we all know what a hawk is, right? A hawk is circling the skies, constantly looking down for prey. And when it sees the prey, it sort of swoops down and it gets its prey.
Right.
Well, this is a very different kind of hawk. It's not circling the skies for prey. It's actually encouraging people to pay attention in every interaction that they have for subtle cues or signs that the other person may be expressing something vulnerable. Just trying to cue people in to maybe something's going on with that other person. Maybe it's just asking them, how are you doing? Maybe it's something deeper. But is there something softer or more vulnerable that this other person is expressing that if we attune to it, we maybe will be able to respond to more fully with something that's ultimately more connecting. So that was actually the whole tip, just trying to get people to pay attention in their relationships to the other person with more sensitivity, and then just respond as you would.
So that's a super cool one. But if I have no idea what it's like to be a hawk, and I have no idea what vulnerability looks like and I'm putting this in air quotes, as prey, did you help people say, this is what vulnerability can look like when people are sharing with you? Did you give it some scaffolding around that? So, because that can be kind of scary to go up and be a hawk and look for vulnerability.
Well, we encourage people to look for it in subtle ways in their everyday interactions. So it's not necessarily the case that we're needing somebody to disclose something big and deep and personal and private in order for vulnerability to be present. But it just may be just noticing that the other person looks a little tired.
Gotcha.
Or noticing that they just breathed a big sigh of relief about something. Or if somebody says, how are you doing today? They say, I'm a little tired, whatever it may be. Just taking those subtle little things more seriously, looking for those subtle little cues, essentially as opportunities to connect with somebody. So we didn't provide too much scaffolding. I think we did provide a couple of examples of it, but we really just encourage people to just try to pay more attention in this way. We asked people at the end of each tip that they received at the end of each day, which tips they liked the most, which tips they felt were most helpful to both to their mental well-being and to their relationships. And people responded really well to this vulnerability hawk tip. They seemed to really like the idea of just attuning to other people rather than being so self-focused.
And I can imagine, I mean, and again, with the pandemic, with people locking down and all of these feelings and everything, sometimes, and I've heard people talk about, I just need to get out of my head because there's all this news coming in and it's confusing. And at the same time, we have, civil unrest and so many other things going on in the world. And so for people to be able to say, I'm out of my head and wow, I'm just listening to you. I could see where that could be very fulfilling and very strengthening. Dan, any other tips? So these are great.
Yeah, I'm looking through our list here. I mean, I think a lot of the tips, especially those that focused on sharing of oneself, had some different categories just so that we were moving people through different domains of content. Now, similar to what Jonathan said earlier, there's a basic dance step that we were working from. So the content at some level wasn't the most important part, but we needed to have people talk about something. So for example, we had some questions that came from a famous experiment years back called the Fast Friends procedure, where people could answer just fun, somewhat intimate questions about themselves, whether that is, tell me about a cherished memory, or, or who are some of the people you look up to or heroes in your life, or giving people some opportunity to just have some relatively easy, but meaningful, important content areas to talk about, and then to respond in a reciprocal way to their partner, the person they called, who is willing to share with them. We had some invitations to share with others some sources of grief and loss, which we know have been profound for people, especially in a cumulative way, month after month of this pandemic. On the flip side, we asked people to locate sharing some good feelings, like where they derive their strength, sources of what feels most important. We asked, in similar ways to talk about different strengths that they held and things that they're most proud of. Those were other examples, especially of the sorts of tips that focused on getting people out there sharing parts of themselves with others.
And so hearing all of this, and I want to be really respectful of time. So you've got these 1,500 or so people, you're giving them these tips every day. Did it work?
The short answer is yes, it did work. There's a more complicated answer, however. We were tracking how people were doing every day. And what we saw was, once we started giving people the tips, people's depression started to go down, their loneliness started to go down, their relationship quality started to go up. And that continued to accumulate over the course of the 2 weeks when we were giving people tips. So in other words, the bigger the dose, the bigger the effect.
Yes.
Such that by the end of the 2 weeks, people were having a fairly decent effect. At the beginning, not so much. But once we stopped giving people the tips, they stopped improving. And so that was a bit of a downer for us. We didn't design the intervention in a way that we were really teaching people how to do this on their own.
Mm-hmm.
So I think we could analyze exactly how to keep it going for longer, but because we rushed this, we wanted to get it out quickly. That wasn't so much in the forefront of our minds. How do we get people to sustain this over time? And so what we saw was that after we stopped giving people the tips, the benefits started to decrease, which is of a concern. And so I think that the take home is, it is useful. These tips are important. And in order to really have the public health impact that we want, we have to either keep giving people tips for longer or build in strategies to help people take this on the road better and do this more on their own.
I think one of the big ideas for us, is that social connection is incredibly important to psychological health and well-being. And it's something that we believe is understudied and undervalued, that we don't take perhaps as seriously is the wrong word, but seriously as maybe we ought to from at least a scientific perspective. So maybe in an imperfect analogy to say, if you're attempting to intervene on thirst, you need to give somebody water, right? In the same way, if you're intervening on loneliness, you need to give somebody social connection. But, once you stop drinking water, you wouldn't expect somebody to stop being thirsty. And, I think exactly as Jonathan said, because we weren't building in the sort of learning that would allow someone to generalize what they were up to during the study and keep it going. And because we're really just confined to these 2 weeks of the intervention, we had sincerely hoped that there would be a more cumulative, longer lasting effect. But at the end of the day, it's actually not surprising. And if anything, it reinforces the idea that it's important, right? It's important to stay connected and to stay in relationship with other humans, especially during this time.
Dan, I don't know if I told you this, but I'm thinking now of this one woman who emailed me after the study started, and she wanted to be in the study, but she's an elderly woman living in Mexico. And we, because of research purposes, had defined our sample as you needed to live in the United States. And so I emailed her back and said, I'm sorry, we can't have you be in the study. And she emailed me back expressing disappointment. And something about her email really struck me. I didn't want to just say no to her. And so maybe I obviously couldn't do this with too many people, and maybe it was a mistake, but I said, I'm happy to send you the tips myself as outside of the study. And so I actually developed a relationship with her. I sent her the links to the study tips every couple of days, and I did some of the stuff with her. And then we actually, like I said, developed a relationship only over email, and actually kept it going after the tips had ended for a while. And now as you're telling the story, I'm thinking, oh my gosh, it's been several months since I've heard from her. Like, we stopped our relationship too. We didn't keep it up. And now I'm worried about her, and I want to email her. So I think this is the way relationships work. We have to constantly nurture them and keep them going. And sometimes we just need the reminders to do so. And that's important.
Well, in hearing you both talk and about the social connection piece, and the work that you have done on this, and I'm looking at this through both a therapist viewpoint as well as a public health viewpoint, is where else do you guys see space for connections between public health and psychology? Whether it's around the pandemic or whether it's around anything else. I mean, whoever would have thought social isolation would have been considered a public health issue, but yet it is. And so when you take a look at this, where else do you see opportunities for our two fields to collaborate?
Well, I think the idea of social connection, the positive, intimate relationships, good relationships, the positive, and then the downside, social isolation or loneliness, that plays out across multiple contexts in our society. It plays out in organizational settings, it plays out in families, it plays out in educational settings, it plays out in interactions between patients and medical providers in healthcare settings. It, of course, plays out between the community and police. Everywhere we look, there are opportunities to improve relationships. And so I think you can really sort of pick whatever area you have passion in, and there will be opportunities to improve relationships in that area and improve public health. I think the field is vast and it's wide open, and there are a lot of really good people doing a lot of good research across all these domains. So it's hard to really pinpoint one thing. I think the field is so vast.
And hearing that message is just so affirming. Because we all know that the more connections you have and the more social supports that you have, the better your health outcomes are. And so can you imagine if we did that across the whole community? You know, public health says, you know, private care and primary care and one-on-one care says, you are my patient, but public health says the community is my patient. And to be able to say, if we created those kind of connections across the community, what would that do to the health outcomes of that community?
Yeah, and you know, we often talk about the silver linings of the pandemic, the lessons learned from the pandemic. It's hard sometimes to talk about the silver linings given how much suffering there is. But I do think this is a legitimate one. If the pandemic has taught us that relationships and social connections matter, if the pandemic has reminded us that these relationships matter, not just at the individual level, but at the community level, well, then, yeah, that is a good thing. And I hope we can bottle that lesson and keep drinking from that bottle even after the pandemic is over.
Yeah, no doubt. You know, I would just add to that our big hope in our shared work, and Jonathan and my studies and research is, you know, one of the big ideas is how do we translate psychological science that's often confined to these one-on-one client interactions, and how do we take those same mechanisms and that same science and apply it to more social challenges. And so, you know, in this study, we were really looking to do that in this domain of social connection during the pandemic, of course, as you've named, and all of those contexts that were just thinking about, especially right now, I'm thinking about here in Seattle, all of the kids going back to school, right? And how, you know, if we don't think that there's going to be some real, you know, onboarding required of social emotional skills and learning as part of, you know, getting back to school a year plus later, we're kidding ourselves in terms of what's going to be required to support young people right now. And so I think there is real opportunity for psychologists and for public health folks to be engaging some of this science and some of these principles of behavior change and relationship connection and formation in ways that we don't always scale up and take advantage of. And then, you know, I think I'd be remiss if I didn't also mention that most of the work that Jonathan and I do together is about developing clinical interventions for reduction of racial bias and racism in social interactions, sometimes termed microaggressions. And whether that's in healthcare or in the legal profession or in community settings. And so, you know, I think another huge thing that has been part of this pandemic, another pandemic within the pandemic, and that we're continuing to think about from more of that public health lens is how do we scale those interventions so that we can actually deal with the realities of bias and racism in all of its forms across our communities.
And again, getting at it at the community level, and really making those broad changes, and how do again, just hearing you talk, how do these two fields work together and address all of those huge complex issues. Yeah,
for sure. And you know, I guess it's also, I'm sure we both want to say that it's the two of us that are sitting with you today because we were the leads on this particular study, but we work with a much larger research team. And so there, even though we're the two today talking with you, there, you know, another 6 or 12 people that we need to honor that are part of this larger team of ours.
Well, and that right there, just role modeling. How do we make sure that the people we work with feel valued? And again, making that connection. So Dan, thank you for that. I want to be very cognizant of time. I know I said that a few minutes ago, and this is such a rich discussion. It's hard to cut it off, but gentlemen, before we wrap this up, what should I be asking that I don't know enough to know I should be asking about any of the work that you're doing, or anything you want to add?
I'm not sure. I think we hit all the major topics. Yeah, I think it's a little bit hard to know what exactly to do next with the intervention. We want to now get it out to more people. We're still analyzing the data and working on finishing up the first project, but our next steps are to try to get this out to more people in an effective way. So
that makes sense, especially if like you said, if it works, and we just need to keep on getting it out there. So Dan, Jonathan, thank you so much for spending your afternoon with me. This is really good stuff. These are really great collaborations, and most importantly, it's making a big difference. So just want to say thank you.
Thanks, Robin.
Thank you.